This video is for basic facial, starting the video at time of arriving to work. What I would do first is I would wash my hands at the sink. So I'd wet my hands, I'd find a coin-sized amount of liquid hand soap, wash my hands down to the wrist, and I would wash the back of my hands all the way down to the wrist. I would wash my fingers, and I would wash the back of my fingers. I would wash my fingertips and my nails. I would wash between my fingers and my thumbs, between my thumbs, wrists. Do all of that wash for a minimum of 20 to 30 seconds, and then I would do a good, thorough, proper rinse underneath the sink. When everything's rinsed off, I would grab either paper towels or clean towel and turn the faucet off. Dry my hands. If it was paper towels, they'd be in the trash. And then if it's a towel, it would be now dirty and it would go in a closed container until time for laundry. Then I would find my 70% ethyl alcohol, sanitize my hands. And that would be clean hands and ready to set up and prepare my room for my client for a basic facial. So let's talk about what we need to do to get started. We would disinfect our workstation, bed, and equipment using a disinfectant wipe following manufacturer's instructions. We would check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We'd gather clean supplies needed for the facial service, storing in a clean, closed container. And we're gonna do every single thing that we possibly can before the client arrives. That way our schedule is very mindful for their day, our day, the appointments that we have, the appointments that they have. It's just extremely professional to be prompt, and you want to do all of your setup that you possibly can ahead of time. We would turn on the hot cabbie and stock it with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We will fill a clean steamer glass with distilled water, and we would preheat the steamer. Then we would dispense products needed for the service according to skin type and client's needs as follows. We would prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or we could remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. We would drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel along with a roll towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So I'm just going to review what I have on my tray set up ahead of time for my client, and I've made my bed for the client, and we'll review all of that and move forward. So because I'm doing a basic facial and it's an existing client, I'm able to prepare a lot. And you can prepare most things even if it's not an existing client based on that first time facial appointment. You may not be able to get out certain things or dispense certain things, but you can certainly be prepared with the amount of bowls you need or amount of brushes, implements, etc. All the things like 4 squares, 2x2s, etc. So on my tray, I have makeup remover, it's a given, cleanser, I have an exfoliant, I have a massage, mask, and I have eye cream and moisturizer based on the fact that I know the client already dispensed. I've got 4x4s, 2x2s, cotton rounds, toner, water, wooden stick Q-tips, astringent, and gloves for my extraction process. I've got a brush for my mask. I've got some of those wooden sticks that I would dispense product out to my hands. So I'm ready to go for my client. I have to wait until my client arrives. And then when my client arrives, I will be performing a client consultation. And that's pretty critical. One thing to know before I do my client consultation is I would always approach my client with clean hands. So you saw me wash my hands upon arrival, and I would always continue that, and I would be washing my hands before I went to meet and greet with my client. I'm going to wash my hands again before I start the service, but just noting that I would never greet a client with dirty hands. So I'm going to go out. My client has arrived. It's her appointment time, and greet her and escort her to the work area. I would be at that point taking a seat with her, determining her preferences and assessing her needs. Then I'm going to look at the skin and perform a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation like lice, to prevent from safely performing the service. I would assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. I would consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care. I'll assess if the client is prone to cold sores or fever blisters. I'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. And I would assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers, because all of those are contraindications for a basic facial. And we could go into detail and should go into detail with the client consultation form. You're going to review that with the client. You're going to read over that in detail, making sure that nothing would be harmful today to the client. So there's no ingredients that they might be allergic to in your products, that they're not on any medication that may be doing something to the skin that would then not allow you to perform the service, like all of these questions have said. And that's just really critical to take the time to do what you need to do to make sure, as a skincare professional and expert for your client, that you're taking good care of them. So thankfully, our client is in good shape. So this is just where, you take that time to really ask those questions and get to the details. And if it's something that you don't know, you look up. If it's a medication you've never heard of, you ask why they're taking it, and then you go from there, etc. So that is done, and we're going to give our client some privacy so that she can change and get comfortable for the service. So you'll escort her into the actual room where you're going to be performing the service and give her the drape. You'll have everything laid out on the facial bed so that she can comfortably change in private and then get underneath the sheets and blanket. And then you'll come when she's dressed and ready and knock on the door. And when she says she's ready for you to enter, you can come on in. And of course, you've got it beautiful and comfortable for her. So she is laying down, and we're going to make it even more comfortable. So we've got our rolled towel here that we are going to place underneath her head and neck for more support. We have an additional towel that we are going to put across her décolleté to give her a little bit more coverage and comfort. And we also have a hairnet that we are going to pull her hair back with. And that will keep her hair out of the way for the service. And then before you can begin the service, you need to wash your hands again. So we're going to go to the sink, wet our hands, find that coin-size amount of liquid hand soap, wash our hands down to the wrist, and then wash the back of our hands down to the wrist. We're going to wash our fingers and the backs of our fingers. We're going to wash our fingertips and our nails. We're going to wash between our fingers and our thumbs. We're going to wash our thumbs, and we're going to wash our wrists. And we're going to do all of that wash, that interlocking wash, for a minimum of 20 to 30 seconds. When you feel like you've gotten everything really clean, thoroughly rinse it underneath the water. When you're rinsed, you're going to find either disposable paper towels right there or a towel, and turn the faucet off. Dry your hands off. If it's the paper towel, it can go in the trash. If it's the towel, it's dirty now, and it'll just go into a closed container until time for laundry. Then grab that hand sanitizer, and you're going to use it 70% ethyl alcohol, and you're going to sanitize your hands before you start the service. And then you are ready to begin. So the first thing you're going to do is remove any makeup if your client is wearing any. Ours is a very glamorous girl, so yes, she is. just take your time to do what you need to do to remove makeup. And then we are going to do our initial cleanse of the face. So the first thing we're going to do is do a cleanse. And then I'm going to go ahead and remove this first cleanse. And then we're going to cover her eyes because we're going to do a proper skin analysis. So what we're going to do is we're going to bring over either magnifying lamp or Woods lamp. And I don't have those, so we're just going to talk about what we're going to do. But we do need to cover that client's eyes. We really want to protect them from that bright light or intense light. So we would be bringing it on over and turning it on. And this is where you really do want to take the appropriate amount of time. This is where you get to look through the magnifying lamp at the skin, the face, the neck of the skin of the face and the neck, and décolleté too, maybe if that's a part of your service today. But there's a lot of things that you may want to be looking for, and obviously it's going to be different. Well, you're going to look for things on every client, but particular things, particular focuses for each client. They may have different goals, or they may have things that they've asked you to take a look at, or concerns. So maybe a particular client is dealing with a little bit of a breakout. So they're talking about excess sebum. They want you to look at the breakout. They want you to see the intensity of it or the severity of it. They want you to see if they're going to need a lot of extractions. They want you to look at the areas where you see it or don't see it. And then it could be many other things other than that. Dehydration, fine lines, and wrinkles. It could be hyperpigmentation or redness. It could be, which could be, red or brown. It could be that they want to look at the freckling. They've got moles. All of these things, like there's a huge, vast amount of things that you're looking for. Capillary issues, anything that you feel like you could do or that you need to learn about that client's skin. This is where you're really going to dig deep and look. You're going to look at see if they've got some aging skin or maybe some acneic skin. Like you're just really going to get in there and look and take the time, because you're going to go back to either your client consultation form or your software system with your client, and you're going to be putting detailed information about what you see. And that way you're going to really learn that client's skin, not only for treatment purposes, what you're doing today, what you're going to recommend for the future, what you guys are working together as a team on in improving the skin, what they were doing at home, what you're doing in service, product recommendation that you're going to want to make for them to take home and use, and how to use. All that's going to be in your records. And then you're going to notate everything, like if they have a mole, where they're freckling, if they have a certain area of a breakout or a really dehydrated area. All those things are going to matter, or something that they've asked you to work on. Maybe like they're dealing post-pregnancy, they still have a lot of melasma and they really want to work on that hyperpigmentation with you. So there's all those kind of things that you're going to be looking at and documenting. And then if anything changes, you would be the person to then be able to maybe see it first and then redirect them to a physician if it's something that's needs to be looked at, or some really big positive that you want to share with them, how you can see on a deeper level how things are getting better. So it's really important to take the time here. And once that's done, you would take the lamps away, turn the light off, and then you can remove the covers on the eyes, and you're going to go now in with the second cleanse. And then third and final cleanse. And not everybody may need 3 cleanses, but if your client does, they do, and that's okay. After that third cleanse, we're going to remove it. And then after you finish that third and final cleanse, we're going to tone. So I'm going to note here that you'll see that my spray nozzle does not come in contact with the 2x2s. So I keep that distance there for sanitation reasons. Obviously, we want to keep that clean. It doesn't need to touch the sprayer. And then it's time to exfoliate. So what I'm going to do is I'm going to take a pea-size amount of exfoliant. And you can do a chemical exfoliant or a physical. You can brush it on. You can do like I'm doing. I'm spreading it out because I'm going to massage it in. It's a physical one. I'm going to massage it in for 1 to 2 minutes. And I'm always going to avoid the eyes, the nose, and the mouth in everything that I do during the facial. So you'll see that, but just note that. And of course you would want to read and follow manufacturer's directions for anything that you're using. And then once you finish your 1 to 2 minutes of this massaging and this physical exfoliant, I'm going to read and tell you what happens next because I don't actually have the equipment. So I'm just going to walk you through what would happen after you do that. So we would retrieve the steamer and turn it on. That's the one we preheated during our setup procedure. And we are going to position the steamer next to the facial bed, making sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, position the steamer 16 inches over the client's face and aimed at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. We're going to remove the steamer from the client's face, return the steamer to its previous location for disinfection. So let's just go over that. We would find the steamer that we preheated, we'd bring it over to the facial bed, and we would aim it away from the client as we turn it on so that it can take time to fully heat up and emit that outflow. Then you're going to turn the steamer towards the client's face, aiming it at the chin about 16 inches away, and then that mist will evenly distribute over the face. You're going to do that for 3 to 5 minutes, and then when it's done, you're going to turn it away from the client, turn it off, and you can return it to its previous position until it's time for disinfection. One thing to note is that because we're doing a video, we're just going to proceed as if the 3 to 5 minutes has elapsed and we don't have that facial steamer. So we've done the steamer, the time's passed, and then what we would need to do is get a towel from our hot cabbie. We don't have a hot cabbie either, so we're going to pretend like we do, and we've got a towel here from our hot cabbie. We're going to shake it out because it's hot. We're going to test that temperature on our wrist, and we're also going to test the temperature once we feel comfortable with it on our client's collarbone. She thinks it feels great, so we're going to take this steam towel and we are going to wrap it around her face. With her nose will be left out so she can breathe, and then we're going to let it rest there and do like a little gentle press. Now you'll start to feel it cool down probably in about 20 to 30 seconds. So you'll just know when it starts to cool down is when you can remove the steam towel. then once you've removed that exfoliant, you need to dry your hands thoroughly, because now you're going to perform extractions if your client needed you to. And this client doesn't have a lot, but she does have a couple of little congested areas that we want to address. So get those hands nice and dry, and we're going to put on our disposable gloves. Okay. So, you can do extractions a couple ways. You can take round Q-tips, you can soak Q-tips, cotton rounds, and you can soak them in astringent and then do your extraction that way and work your way around the cotton rounds and then toss in the trash. I'm going to use the wooden stick Q-tip, where you take a pair, so 2, soak them in astringent, and then for each extraction, then you toss them in the trash. So you only get to use them once. So we're going to soak them in our astringent, and we're going to go in and perform our extractions. So she has a little bit around her nose. She has a little bit on her chin, and she's not had that problem, but she's been wearing a mask lately like we all have, and like a lot of us, she's dealing with a few different things than normal. That sometimes keeps humidity in. We're certainly breathing out carbon dioxide into our mask. All of those things can come into play. A little sweatier, a little dirtier, a little bacteria can build up. And we've got one more we're going to address here. With extractions, you don't want to perform them any more than 5 to 7 minutes, because that can be somewhat painful. Another thing to note is you could cover the eyes and bring the magnifying lamp in, which you probably would want to do. I just didn't do that because we don't have a magnifying lamp, but you would probably want to cover the client's eyes like we did before, and then that way they're protected while you're having a better visual angle at what you're doing. You're going to need to turn those lights on. So your gloves are going to come off, and they're going to also go in the trash. They're disposable. So of course, after extractions, you would toss your gloves. And then we're going to follow with toner. And once again, I'm going to make sure that my container does not come into contact with my cotton rounds. And the good news, after extraction and toner, she gets to have the massage. Now, if a client was severely broken out or dealt with cystic acne, you would not be doing this massage. That would be something different. But because our client she has normal to dry skin, this is going to be excellent for her. One thing to note with your massage, you always want to make sure that you get enough massage product out into your hands and on the client before you start the massage, because you do not want to have to go back into your container for any reason once you start the massage, because this is the really, really relaxing part of their facial, and we want to let them relax and enjoy it. So you don't want to have your hands leave their face. So then you're going to want to remove the massage product. And then you would be applying the mask. So that's what we're going to do now, is we're going to apply our mask with a brush. Once again, avoiding the eyes, the nose, and the mouth. And you would always want to be following manufacturer's directions for your mask, just like everything else. So making sure you're comfortable with that, you've read all of that, you know what your plan is, and we are going to say, for all intents and purposes, this mask would stay on for anywhere from 5 to 10 minutes. We're going to go ahead and say that because we're doing the video, that time has elapsed, and now we're going to go ahead and remove our mask as if it has already been on for the allotted 5 to 10 minutes. once you remove the mask, you're going to tone one final time. Once again, not coming in contact with the sprayer. And then you're going to go ahead and apply skincare, and it is nighttime, so we're going to apply a little bit of eye cream, of course. We're going to apply that with our ring fingers, super delicate fingers, delicate area. We're going to lightly tap, and we're going to go on the brow bone and the zygomatic arch real gently. And then we're going to apply moisturizer. We are not applying SPF, so that she can go home and she doesn't have to wash her face again. When she gets home, she can actually just have her skincare on and be ready for bed and relax. But she is purchasing her moisturizer with SPF for the day. I'm gonna make sure that I get it everywhere. Neck, this particular moisturizer, which I would with the SPF as well. She knows the importance of sunscreen, how it's the #1 cause of aging. And then one final thing, we're gonna do a little bit of a lip product. A little moisturizer on the lips as well, so we can present the skin, and she's just blown away by how beautiful she looks. Now we're going to finish up this facial. And then we would allow her some privacy to put her things back on, and then she could meet us out in that client area so that we could then go over her maintenance and aftercare. And she is in love with it. She can't believe how good her skin looks and feels. So we're just going to review and discuss the products that she's going to be purchasing, taking home today to maintain until her next appointment, which she's also booked. And we get her checked out and on her way, so she can have a great relaxing evening. And then we've got to get back to this room, clean up, next client. So of course, what we're going to do is get back into the room and look and see if we've missed any of our single-use items that need to be discarded. We'll toss them. Of course, we are going to find any implements that we've used, put them in a closed container labeled to be disinfected. Our bedding sheets, we're going to strip the facial bed and put every bit of that dirty laundry in a closed container until time for laundry. And then we are going to find and identify a proper cleansing agent. We're going to read manufacturer's directions and follow them for mixing and usage so that we can wipe down all of our area, completely cleaning it, and the station, everything, to remove any debris. Then we're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. We are going to put disposable gloves back on because we're going to need to have gloves on in order to follow those manufacturer's directions for mixing and or using appropriate aerosol disinfectant. We are going to disinfect electrical equipment, store it in a clean area separate from other implements. Then you can take those disposable gloves off, toss them, and it's time for that final hand wash. So you're going to wet your hands at the sink, get that coin-sized amount of liquid hand soap. You're going to wash your hands together down to the wrists. You're going to wash the back of your hands down to the wrist. You're going to wash your fingers, and you're going to wash the back of your fingers. You're going to wash your fingertips and nails. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs, your wrists. You're going to do all of that wash for a minimum of 20 to 30 seconds. When you feel like you've gotten that clean, you're going to rinse thoroughly underneath the water. When you have that proper rinse, grab some paper towels or a towel, turn the faucet off. Dry your hands thoroughly. Paper towels can go in the trash. The towel is now dirty. It can go with that other laundry in the closed container. until time for laundry, and then you're going to get that hand sanitizer, 70% ethyl alcohol, and you are going to rub your hands together, doing all of that same stuff with the hand sanitizer to really get that finished cleanse, and then you can go ahead and set up for your next client. So this concludes your video for basic facial.